Pathological Basis of Oral and Maxillofacial Diseases is a first edition published in 2025 by Wiley-Blackwell and edited by Sr. Prabhu, Syed Ali Khurram, Omar Kujan, and Merva Soluk Tekkesin. The book belongs to the field of oral and maxillofacial pathology, but it also integrates general pathology, oral medicine, genetics, immunology, molecular diagnostics, oncology, and orofacial pain. The editors intend it for undergraduate and postgraduate dental students, pathology residents, and clinicians. The main problem the book attempts to address is the separation of general and oral pathology in education. A student may understand the mechanism of disease but later fail to connect it with a clinical lesion. The book therefore does not begin merely with a list of diagnoses, but with the question of why disease develops and how pathogenesis explains the clinical, radiographic, and histopathologic findings. The work consists of 9 sections and 35 chapters written by more than 50 international authors. The editors themselves acknowledge that variability in length, style, and depth can be expected in a multi-author work. The organization progresses from homeostasis, cellular injury, immune defense, healing, and genetics, through infections and systemic diseases, to neoplasia, oral potentially malignant disorders, tumors, jaw lesions, and orofacial pain. For dentists, the chapter on laboratory diagnostics is particularly valuable. Its central message is that histopathology should not be interpreted in isolation. Clinical information, radiographic findings, and microscopic features must be correlated, while complex cases may require additional testing and multidisciplinary discussion. The example of a dental follicle that can resemble an odontogenic myxoma without radiographic context clearly demonstrates the risk of misinterpretation. This is an immediately applicable principle. The quality of a pathology report also depends on the quality of the information the clinician provides to the pathologist. The chapter presents the processing of resection specimens, surgical margins, histologic stains, direct immunofluorescence, immunohistochemistry, and molecular testing. The scientific value of the book is high, but not equal in every section. This is neither a systematic review nor a clinical guideline with formal grading of evidence. The authors use classic studies, textbooks, systematic reviews, meta-analyses, consensus documents, Cochrane reviews, and contemporary classifications. It is particularly important that the chapters on tumors are based on the 5th edition of the World Health Organization classification of head and neck tumors. Independent verification shows that the International Agency for Research on Cancer continues to list head and neck tumors as the 9th volume of the 5th edition, published in 2024, so the book's fundamental classification framework remains current. In the chapter on oral potentially malignant disorders, the authors are particularly effective in distinguishing established facts from uncertainty. The histologic grade of oral epithelial dysplasia remains an important prognostic indicator, but the book clearly notes subjectivity, inter-observer variability, and sampling errors. Biomarkers, aneuploidy, and loss of heterozygosity are presented as promising, but not as sufficiently reliable to determine treatment on their own. Risk assessment therefore includes biopsy findings, lesion site, size, multifocality, and appearance, as well as risk factors, comorbidities, and patient history. The authors state that lower-grade lesions are generally monitored while risk factors are controlled, whereas moderate and severe dysplasia are more often surgically removed. But they acknowledge that universally accepted evidence-based protocols do not exist. The recommendation for regular lifelong follow-up of patients with oral potentially malignant disorders should therefore be understood as a pragmatic response to the unpredictable natural history of these diseases rather than as a conclusion derived from a single definitive clinical trial. It is also appropriate that detection of human papillomavirus deoxyribonucleic acid alone is not equated with a biologically active carcinogenic infection, while for Candida the authors state that it has not been established whether it causes carcinogenesis, promotes it, or merely secondarily colonizes altered epithelium. Another important clinical recommendation concerns jaw lesions. The chapter on odontogenic and non-odontogenic cysts emphasizes that a definitive diagnosis of an intraosseous lesion requires correlation of clinical, radiographic, and histologic findings. Conventional radiography is often sufficient for basic assessment, whereas computed tomography and magnetic resonance imaging may be required for larger lesions and surgical planning. A practical table compares the most important cysts according to location, radiographic appearance, and histology and demonstrates why a diagnosis should not be made solely on the basis of a radiolucency. A third important area is oral squamous cell carcinoma. The book states that localized periodontal destruction in a patient without generalized periodontal disease, particularly when accompanied by a red or white lesion, should raise suspicion. At the same time, it does not overestimate histologic grade, which has limited prognostic value, but places greater emphasis on depth of invasion, perineural invasion, pattern of invasion, and lymph node status. A fourth useful area is the oral-systemic relationship. In diabetes, the book cites a Cochrane review providing moderately certain evidence that periodontal treatment may reduce glycated hemoglobin in the short term, while emphasizing that mechanistic evidence is limited and partly contradictory. The chapters on orofacial pain explain peripheral and central sensitization and the influence of emotions, sleep, and psychosocial factors, and support a biopsychosocial approach, but they are more pathophysiologic than therapeutic and do not constitute a standalone guide to the treatment of chronic pain. The book's greatest strengths are its integration of basic pathology with specific oral diseases, its insistence on clinical radiographic pathologic correlation, its inclusion of contemporary molecular pathology without presenting every biomarker as a ready-to-use clinical test, the quality of its illustrations and tables, and the author's willingness to acknowledge uncertainty when the evidence is insufficient. The weaknesses are also clear. As a multi-author work, the book is uneven. Some chapters explain disease biology in detail but provide fewer concrete algorithms for clinical decision-making. Treatment is not the primary focus, so dentists expecting a step-by-step protocol will not find one. Some of the literature is older where it addresses fundamental concepts, while rapidly evolving topics, particularly molecular oncology, biomarkers, and targeted therapies, require consultation of newer guidelines. The book was published in 2025, and much of the literature extends through 2022 and 2023, making it very current, but it cannot be assumed that every therapeutic recommendation is automatically the most recent in 2026. A separate systematic literature search would be required for a complete assessment of changes that occurred after the manuscript was prepared. Based on the available sources, this cannot be reliably assessed. For students, the book is particularly valuable because it explains why a lesion looks the way it does. For younger dentists and general practitioners, it is useful for differential diagnosis, biopsy-related reasoning, and recognizing cases that require a pathologist or multidisciplinary team. Residents in oral medicine, oral surgery, and oral and maxillofacial pathology are likely to benefit the most, while specialists and faculty members can use it as a reference resource. The three most important professional concepts are that diagnosis emerges from the integration of clinical, radiographic, and pathologic information, that a molecular marker is not the same as a clinically validated predictive test, and that a histologic diagnosis acquires its full meaning only when it is linked to the biological behavior of the lesion and the next clinical decision. Does the book deserve a place in a professional library? Yes, particularly for colleagues who want to understand pathology rather than merely recognize images. I would recommend it most strongly to senior dental students, residents, oral surgeons, oral medicine specialists, and pathologists. A dentist looking exclusively for a quick procedural manual can reasonably skip it. Its greatest value lies in integrating disease biology with contemporary diagnostics. Its greatest weakness is that its breadth comes at the expense of uniform clinical operationalization. It is best regarded as a serious textbook and reference manual rather than as a clinical guideline. If the question is whether it is worth the time required to read it, the answer is yes. particularly if you want to understand why you make a diagnosis rather than merely what that diagnosis is called.